As a parent, encountering a fever in your little one can be concerning. Fevers are common, especially in babies and young children. A fever is a sign that their body is working hard to fight off an infection. Fevers are actually a natural defense mechanism. When germs enter your baby's body, their immune system releases chemicals that raise their body temperature. This helps to kill the germs and prevent them from multiplying. While fevers can be alarming, they are usually harmless and resolve on their own. Most fevers last for a few days and are a normal part of childhood. However, there are times when a fever can be a sign of a more serious illness and requires medical attention. It's important to remember that every baby is different, and what is considered a high fever for one baby may not be for another. If you are ever concerned about your baby's fever, it's always best to err on the side of caution and consult with your pediatrician. A normal body temperature for a baby can range from 97.5 degrees Fahrenheit, or 36.4 degrees Celsius, to 99.5 degrees Fahrenheit, or 37.5 degrees Celsius. Anything above this range is considered a fever. A low-grade fever is typically between 99.5 degrees Fahrenheit, or 37.5 degrees Celsius, and 100.3 degrees Fahrenheit, or 37.9 degrees Celsius. A moderate fever falls between 100.4 degrees Fahrenheit, or 38 degrees Celsius, and 102.1 degrees Fahrenheit, or 38.9 degrees Celsius. A high fever is anything above 102.2 degrees Fahrenheit, or 39 degrees Celsius. For babies under 3 months old, a rectal temperature of 100.4 degrees Fahrenheit, or 38 degrees Celsius, or higher is considered a fever and requires immediate medical attention. For babies older than 3 months, a fever is typically not a cause for concern unless it reaches 102.2 degrees Fahrenheit, or 39 degrees Celsius, or higher, or lasts for more than 3 days. While most fevers are harmless, there are certain situations where you should seek prompt medical care for your baby. If your baby is under 3 months old and has a fever of 100.4 degrees Fahrenheit, or 38 degrees Celsius, or higher, contact your pediatrician immediately. For babies older than 3 months, seek medical attention if their fever reaches 102.2 degrees Fahrenheit, or 39 degrees Celsius, or higher, or lasts for more than 3 days. Additionally, if your baby has any other unusual symptoms along with a fever, such as a rash, difficulty breathing, or persistent vomiting, seek medical attention right away. It's important to trust your instincts as a parent. If you are ever concerned about your baby's fever or overall well-being, don't hesitate to contact your pediatrician for guidance. Section 4. Debunking fever myths, practical advice for parents. There are many myths surrounding fevers in babies. One common myth is that all fevers are dangerous. As we've discussed, fevers are a natural defense mechanism and are usually harmless. Another myth is that you should try to sweat out a fever by bundling your baby up in layers of clothing. This can actually be harmful as it can prevent their body from cooling down naturally. Instead of bundling your baby up, dress them in light clothing and keep their room at a comfortable temperature. You can also give them a lukewarm bath to help bring down their temperature. It's important to note that you should never give aspirin to a baby or child with a fever, as it can lead to a rare but serious condition called Reyes syndrome. Section 5. Comforting your little one. Tips for easing discomfort. When your baby has a fever, it's natural to want to do everything you can to comfort them. One of the most important things you can do is to keep them hydrated. Offer them plenty of fluids such as breast milk, formula, or water. If your baby is eating solids, you can also offer them foods that are high in water content, such as watermelon or cucumber. Make sure your baby gets plenty of rest. Fevers can be tiring, so it's important to let your baby sleep as much as they need. You can create a calm and soothing environment for them by dimming the lights and reducing noise. Cuddles and reassurance can go a long way in comforting a fussy baby. Hold your baby close and let them know that you are there for them. You can also try singing to them, reading them a story, or simply rocking them gently.